Me to talk is Michael Hurley, president of Ontario Council of Hospital Unions. He joins us tonight from Ottawa. Michael, thanks for your time.
My pleasure. Thank you.
The minister says we should not be afraid of innovation. What's your biggest concern here?
Well, I mean, we know that private healthcare comes, and there's lots of evidence for this, with much higher costs. It has, in the case of private clinics and private hospitals, higher death rates, and we know that the health outcomes are generally speaking worse. And you couldn't have a more clear example than the case of the thousands of seniors who died in Ontario long-term care for-profit facilities during the course of COVID, many of them of neglect, at the same time as shareholders were receiving payouts from those corporations. And so this is a very disturbing announcement by the government, and these private clinics or whatever they are will actually compete with hospitals like the MOFOR that you're showing here and lure staff away because, of course, they're not covered by Bill 124 and the wage restraint legislation.
So you're worried about a staffing crisis getting even worse?
There's a finite number of healthcare staff. You know, it's only so many doctors, nurses, paramedical employees, other hospital staff. And, you know, we already have infrastructure. We have operating rooms which are not being used at the moment. The public will ultimately wind up paying for the duplication of that infrastructure, building new surgical suites or whatever. They will wind up paying for that. And the limited number of staff will be drawn away. That's what happens in places like Britain. And the public system staggers under the weight of that. So, you know, this is exactly the opposite direction in which Ontario should be moving. And based on all of the experience that we've had recently, I'm shocked and appalled that the government would even be considering it or have the audacity to suggest privatization would be the way forward. They must think that all of us are, you know, have a very short memory.
Let me present a flip side and ask you what you think. If it could help with staffing shortages, perhaps could it entice other people to enter nursing, for example, that hadn't considered it before, if perhaps they could get paid more? One of the big problems, the big challenges with nursing is that many of them say there's legislation in place, of course, that's not going to allow them to be paid what they should be making or even to keep up with inflation.
But to follow your logic, then, you know, the higher pay would exist in the private system, so people would go to work there. And in the public system, the queues would get longer because the staff shortages would increase. And that's not a solution to our problem. The solution to our problem, I think, is to put in place some measures to actually lift salaries in the public system, use the infrastructure we have there, recruit new people, expand post-secondary education spots for a whole range of user fees, etc.
Let me ask you about issues outside of the crisis in staffing, because I want to know if you think there is an avenue for privatization in other parts of the healthcare system, because the minister was not specific on where she wants to see innovation used in the province of Ontario. So I'm just wondering if you see any avenue for privatization.
Generally speaking, what you see in the scientific studies around private hospitals and private clinics is that death rates are higher, outcomes are worse, costs are more. And for example, in the case of private dialysis clinics, a study in the United States comparing them to public clinics, you see that there's a dilution of the blood products or a reduction in the use of registered staff, higher death rates as a result. And all of this is because there's demand by the shareholders to have greater and greater profits. You see the same situation has unfolded recently in Ontario with major chains, you know, who had care for our seniors. This is the natural consequence of privatizing healthcare. You can't have these two things coexisting where people have to make choices about, you know, whether you should have, you know, this care, the right mix of staff, or whether we should cut that down so that we can increase yield for our shareholders. These two things are not compatible. There is really no place in my mind in healthcare for the private